We're now joined by Dr. Glenmarie Matthews, Director of Complex Family Planning at Rutgers, Robert Wood Johnson Medical School, and Robert Wood Johnson University Hospital. Doctor, great to see you.
Thank you for having me.
Doctor, I met you on a podcast we did recently talking about a whole range of issues, but largely around reproductive rights. Since the decision by the Supreme Court on June 24th, 2022, the so-called Dobbs decision that allowed the states to make decisions about reproductive rights, reversing Roe v. Wade, if you will, the greatest impact, particularly for women of color in underserved communities, is?
I mean, that we continue to be marginalized, that we continue to be the less than, and the people that are impacted most by decisions that are made by people that are not within our healthcare system, that have no understanding of what our patients need.
Okay, talk to me about the doctor-patient relationship and how it's impacted.
So it continues to impact a relationship that was already disfranchised, where we struggle with, especially our Black community, to show the trust that is needed, right? So by impacting this, patients sometimes feel like they can't tell you the full story already before this decision, and they continue to feel that way. They're scared about what that impact will have on them if they've traveled from a different state, what it means for them when they return to that state, really what it means for them in general. Are they going to be imprisoned? Like, people don't know what it means for New Jersey, right? So they just watch the news, they see all the things that are happening throughout the different states, and they're not sure if this is not happening in Jersey. And so when they call, they're even afraid to say exactly what they need their appointments for. So it's just making already impacted relationship even more impacted, honestly.
Talk to us also about, it's an interesting issue because you are part of a larger healthcare system, RWJ-Barnabas Health, a major supporter of public broadcasting, supporter of what we do. I happen to know there's an anti-racism initiative that's very real within the organization. How is this situation in any way connected to that anti-fighting racism initiative?
I think it just broadens what we stand for more. It really helps us to fight, and really gives us a stance. It shows that Barnabas and Rutgers Robert Wood Johnson, we're here for a patient. It doesn't matter your color. It doesn't matter who you are, where you're coming from. We are really here for you. And the organization in general has really taken on DEI, which is diversity, equity, and inclusion, as a big thing. And even within our department, within the OBGYN, we have formed committees really looking at how we can better inform our doctors, get us to be trained in implicit bias, which is a bias that you might have that you're not aware of. So we've been taking really large steps to make sure that we are providing the best care for our patients possible.
I mean, Doctor, we don't get a chance to ask this question enough. Your passion for your work comes from where?
From a small island. I'm an island girl. I came from an island of Jamaica. And really that started when I was 10, when my cousin got pregnant as a teenager, and abortion is legally restricted there. And she had no way of getting an abortion. She was kicked out of the house. It really impacted her future and her projection of who she is. And really at the age of 10, I said, well, I'm going to stand up for women just like this. And I need to make sure that everyone has access to whatever they need. And so that's where my passion is fueled for. And my patients every day continue to refuel that passion. Whenever I encounter someone that is not able to get access, it drives me even more to get them the access to care that they need.
This is a health equity issue, is it not?
It's a major health equity issue and continues to show the impact. COVID only skimmed the surface of really what's going on in this country. And this is really enlightening people, because I feel like sometimes the general public is not aware of what's happening behind closed hospital doors. And this Dobbs is really opening the eyes of people in general. Even if you're not a female, you have a wife, you have a sister that might be impacted by something that complicates their life, and pregnancy right now might not be the right time.
So that people understand this, each state, doctor, has its own laws. And that's what this Dobbs decision said, that each state can have their own laws. New Jersey has its own law, quote unquote, codifying Roe versus Wade. Texas has a different law. Alabama has a different law. California has a different law. What about if someone said, you know what, states' rights? Is it different in your view when that comes to healthcare, particularly in underserved communities?
Yes, it's different in healthcare. Why is that different in healthcare? Because really, if you are privileged, you can afford it. You can travel wherever you want to
That's
travel
right.
to get healthcare. If you're in a state and you do not have the privilege of financial resources, you don't have someone to watch your child for you while you travel 30 miles to go see this doctor and get an ultrasound, then travel another 30 miles the next day to get your procedure, then this is really impacting your life, your family life. So having different states implement different rules and regulation. And in fact, some of these states are states already that are low numbered OBGYN. For example, in Georgia, there is limited number of OBGYN. So we're really talking about something here that's really bigger than state to state.
Final question from my end. Because people who can move around to other states in terms of reproductive rights are doing that, to what degree have you seen your patient load or the patient load of your colleagues increase here in New Jersey?
New Jersey has definitely been having an increase in patient loads. I've seen patients that has traveled as far as from states such as Louisiana. So people are traveling very far to get the care that they need. More abortions are happening. The good news is that in New Jersey, we are making change, and the governor has been so gracious to really listen to the voice of the people and make changes that are impacting our states in positive ways. So we are beefing up our workforce, allowing mid-level such as midwives and nurse practitioner to be able to provide abortion care. We're trying to get them the training they need in order to really beef up our workforce. So we're working hard on this. And New Jersey is seeing an increased number and will continue to see an increased number, but we are ready. We are ready to help the people in New Jersey and the people in other states, wherever they're coming from. We're here for them.
Dr. Glenmarie Matthews, we greatly appreciate your time, your commitment to the patients you serve every day, and thank you so much. Wish you all the best.
Thank you for having me.
I'm Steve Adubato. Stay with us. We'll be right back.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by MD Advantage Insurance Company, Newark Board of Education, PSC&G, the Healthcare Foundation of New Jersey, the North Ward Center, TD Bank, PSEG Foundation, Community Food Bank of New Jersey, and by Robert Wood Johnson Foundation. Promotional support provided by ROINJ and by New Jersey Globe.
Hundreds of thousands of people in New Jersey face hunger.
Now, more than ever.
Together with our 800-plus agency partners.
Now, more than ever.
The Community Food Bank of New Jersey is fighting hunger.
Now, more than ever.
You can help our hungry neighbors by going to cfbnj.org. Join us